Welcome to the Healthy Habits for Active Aging podcast with your hosts, physical therapists Dr. Michael Gorman and Dr. Lauren Bennett. This podcast will discuss a variety of health-related topics focused on educating the aging adult, allowing for an active lifestyle no matter the age. Don't forget to rate, subscribe, and share. Enjoy the show.
Hello and welcome back to another edition of Healthy Habits for Active Aging podcast. We are your hosts, Dr. Michael Gorman
and Dr. Lauren Bennett.
We're two physical therapists from St. Louis, and we are here today to talk about, we know this is the fastest growing sport in popularity in the United States, and I might even say worldwide. And what is that, Dr. Bennett?
It is pickleball. If you've been following us, you know I play it and I'm super excited about it. And of all the episodes, today is finally the day we're talking about pickleball.
So I know you're a heck of a ping pong player, because if truth be told, we have at our holiday party every year, we have a ping pong tournament. And well, I like to say I'm normally really good, but you pretty much smoked me this past year. So anyway, but today we're going to talk about pickleball, because just like with any sport, there's injuries that are a part of pickleball, and people are asking us all the time, can I play? How much should I play? And so it's time to do this. And because this is Dr. Bennett's addiction. So I'm going to let her talk just for a little bit about the background of pickleball, because she knows this oh so well.
Yes. So I have learned about pickleball, taken various camps, learning about the sport itself, how to properly move, and then the injuries supported with it. And so I just wanted to kind of educate everybody, if you're thinking about playing, what you need to be aware of. But just a little background on the sport. For the third year running now, it is the fastest growing sport. More people are playing it. Some people would laugh and argue it's because nobody played it before, compared to any other sport out there. So it's just kind of funny. But where does it originate? It actually started in 1965. It was by three dads in the state of Washington and Seattle, to be exact. And so they got back from playing golf, and they were just kind of like bored, and the kids wanted to play something. So they just kind of threw together this game of badminton, ping pong, and tennis with what they had out of their shed. And then before you know it, I think it was like 1972, a court was made, and then 1975, like the first tournament around that time. So now it is just growing. And I really haven't met anyone as of lately that hasn't at least heard of it. So which is really, really cool. Where does the name originate from? There's a little controversy about it, but apparently one of those three dads, they had a dog named Pickles, and the dog was like super involved in stealing the ball in the game. So that's believed to be where the name comes from. Some people would argue that they need to change the name, but I don't mind it. So 36.5 million people right now are playing the sport in the U.S. By the Association of Pickleball Professionals, the APP. And then, like I said, the past 3 years, it's just been booming. So they're seeing a growth of 158%. And then with that, some tennis players probably hate all of these growing statistics, because there's just more and more places to play these days. I know every time I'm like driving down somewhere new in St. Louis I'm not used to, I'm like, oh, pickleball courts, and they're turning prior tennis courts into pickleball courts, because you can really make like 2 to 4 pickleball courts out of one tennis court. And so tennis players are getting a little salty about that, but lots of people are just playing it. We need some places to play. Very common places that you'll find pickleball to be very popular is California, Florida, and Texas. And this is also kind of funny. People, I feel like in the past, if you say that you play pickleball, people say like, oh, that's an old person sport. Or if you're one of my husband's dad's friends, he'll say that you're playing grandma ball. It's funny, but now the statistics coming out, the average age of a pickleball player these days is like 38.1 years old, more and more kids are getting into it. There's youth programs. It's going to be a college sport one of these days, an Olympic sport, we're hoping, but it is just growing nonetheless. So a little bit of background there.
It's amazing when you talk about 36.5 million people are playing. That's like, I don't know, I think there's like 330 million people in the US. So that's like 1 out of every 10 are playing pickleball. That's absolutely amazing. And just to think that just even a few years ago, it was around, but there was no pickleball courts, at least that I ever saw. And now, yeah, as you said, you can drive around and see how many tennis courts have changed into pickleball courts.
Mm-hmm.
So
Yes.
that's well, that's all great info. But today we really want to talk about pickleball and the aging athlete, because that's what we're truly all about here with the Healthy Habits for Activation podcast. So we know it's a great sport. We know it's rising in popularity. And now we want to talk about, okay, how can you play this so you don't get injured, so you can truly enjoy this great sport. So it's a few things about injuries. From 2001 to 2017, there's about 20,000 pickleball injuries. So that is amazing data. I have no idea how this was compiled, but it's still amazing data. But 30% of the injuries are from fractures and 30% are sprains and strains. So that's interesting, because just yesterday, I got a text from a former patient of mine who will soon be a new patient of mine again. And this patient loves to play pickleball. And unfortunately, she was playing pickleball and somehow tripped and fell, and she tried to catch herself with her right arm, right hand, and she broke her wrist. So there are injuries that happen out there. So, we can't avoid every injury by any means, and the thing is 88% of the people that are getting injured, they're 55 or older. So again, that's not really surprising. As I just said, falls are very common. Sprains, strains are common. Twisting, bending at the lower back. I think people think pickleball is an easy sport. You don't really move a lot. You can be out of shape and you can play it and no problem. But I don't think that's right. I mean, of course, you could just stand there and hit the ball back and forth and not move. But there is a lot of movement in pickleball. So you do have to be, if you want to play it, you've got to get in shape for it. All right. So I think at this point we've talked a lot about pickleball, where it came from. I know that Dr. Bennett could talk about pickleball for hours and hours and hours. But after our commercial break, we're going to come back and we're going to talk about the 5 most common injuries of pickleball players. So we're going to take a little commercial break and hear from our sponsor, iMove PT. And during the commercial break, I'm going to have Lauren start educating me on how to start playing pickleball. So,
yes.
All right, we'll be right back. iMove PT is proud to be the sponsor for the Healthy Habits for Active Aging podcast. iMove PT is a mobile physical therapy company based out of St. Louis, Missouri, and expanding throughout the United States. We bring a unique one-on-one physical therapy experience to the privacy, safety, and convenience of our patient's home, office setting, or the location of their choice. For more information about iMove PT, please go to www.imovephysicaltherapy.com or feel free to email us at info@imovephysicaltherapy.com. Have a great day.
Welcome back to the Healthy Habits for Active Aging podcast. Thank you to iMove PT for being our sponsor every week. We're going to continue on with the pickleball injuries. So as we talked about, the falls is a big problem. Overuse injuries can be a big problem. One of my patients would call it OMG syndrome. Like, she would be late to her appointment and then she would be like, I have OMG syndrome. I'm like, what is that? And she taught me that means one more game syndrome. So not knowing when to quit, improper footwork, technique, and improper equipment, lack of proper form, lack of proper warm up. So all of these things can potentially lead to these next top 5 common pickleball injuries. But the first one is tennis elbow. And I know that I've treated quite a few in the clinic as well. But the impact of swinging and hitting the ball impacts the group of muscles on the back side of the wrist, the stabilizers on the back side. So when you think about how you're hitting your backhand, those wrist extensors, that's a lot of shock going into it. Especially depending on how your swing and your stroke is, you may be asking a high demand through those muscles. And if they aren't strong enough, the repetitive use of it and power we're needing from those muscles, they're going to respond with inflammation. So you may feel some pain kind of to that outer side of the elbow, right in there, kind of that bony prominence, and then a little bit above or below that. And the best thing after that, I would say when patients come to me, and it's pretty acute, meaning it just kind of started hurting them, ice is very critical. More rest. Don't keep pushing through. Gently massaging it to get some blood flow to the area to help that tissue heal. But don't let this continue going and just keep playing. Definitely consult with a physical therapist, somebody that can teach you how to properly strengthen and stabilize that group of muscles. So that way you can go back into playing sooner than later, because I'm sure Dr. Gorman and I have treated so many of these. That stuff can be chronic, and we all want to play pickleball so bad. You don't want to be out of the injury any longer than you have to be. But that being said, choosing the correct paddle is important. They actually make specific paddles out there. You could look them up, but I know like one popular one, if you have trouble with this, is a Pro Kennex pickleball paddle. They're just lighter weight. But there's other brands out there as well. I just don't recommend you loading up your paddle with like lead tape all over it. It's going to make it a lot heavier. So just being conscious about that.
Well, that's great information. And you know what? I am so sorry because I did not let our audience know what you just did. I don't know, was it a couple of weeks ago or last month? You need to just proudly proclaim what you and your husband Austin accomplished
Yeah.
down in Florida. Go ahead, tell us.
Okay, so like 3 weeks ago at this point, Naples in Florida hosts the U.S. Open tournament, and my husband and I have been playing together for about 4 years, mixed doubles, and we were super fortunate this year to get into the lottery and get into enough events, and we went down there and played together for a whole week. And him and I won our division we were playing in our age group, and we took home the gold, and just kind of living the high after that. It's a pretty big accomplishment for the US Open. So it was awesome.
How many teams were you up against?
In our bracket, if I remember correctly, it's somewhere around like 22.
Okay.
Yeah.
So
Yeah.
congratulations.
Yeah, awesome.
And
Thank
hopefully it does become an Olympic sport soon. So you and
you.
Austin can be in the Olympics. Anyway, okay, sorry about that. But I'm so sorry for not telling our audience about it earlier. But okay. All right, we're gonna go back to this. Our next common injury is wrist and hip fracture. So I already told you earlier in the podcast about the former patient of mine who did trip on the court and fractured her wrist. So, I think a big thing is before you start any sport, you have to be screened appropriately. You can't just go from 0 to 60 miles an hour in 1 second. You have to kind of break it down. But before you get into a sport and try to go all out, you definitely have to get screened. So Lauren and I both recommend that you get a good musculoskeletal screen from a physical therapist in your community to just be proactive about it and to make sure, because we're going to be able to find things that are going on that will help you to be able to play pickleball, be able to play it every week or as often as you want or as often as you should, without getting injury. But please be proactive. If you're not active at all, and then you go out on the court and think you're going to play for 2 hours because it's a quote unquote easy sport, I've seen people play. It's not an easy sport. So please get screened. And specifically when we're talking about falls, really you got to get screened. Your balance. So again, go and see your local physical therapist and have them do balance screening to see if there is some balance issues that are there that are going to affect you on the court. Because if you have balance just while we're doing our screening and standing, even if we do single leg stance, it's going to be 10 times harder for you when you get out on the court and you're running. So anyway, so a couple of things as well. Make sure you're wearing proper footwear. Make sure that your shoes are tied and they're snug on you. I have a question, Lauren. Is there specific pickleball shoes?
Yeah, so they recommend either a tennis court shoe or a volleyball court shoe. It provides the most stability. That's exactly what I use. I just go to the local tennis center here in St. Louis, but you could do the same in your city. But
Gotcha.
tennis shoe and volleyball shoe is what's
Okay.
recommended. Yeah.
Awesome. Yeah, I was always curious about that.
Yeah.
Also, to prevent falls, avoid running backwards. Well, we know you got to go backwards, but don't run straight backwards. You're gonna have a really good chance of a fall. And then, when you play pickleball, it can be single, but what I've seen, it's a lot of doubles. So you and your partner have to communicate well, and just to make sure everyone knows where they should be on the court and where you're moving to. But those are just some basic things to prevent wrist hip fractures.
Yeah. So another common injury is the rotator cuff injury in the shoulder. Yes, this sport is mainly played underhand instead of tennis. You serve underhand. There's a lot of dinking at the net underhand, but the most fun part is when somebody does leave it up. You can hit overheads, and especially if somebody is lobbing it over your head, you may be available to hit the overhead. And so if you have any type of sort of degeneration already, weakness, overuse, and you're having pain in your shoulder, that overhead movement is going to become trouble. So again, talk to your physical therapist. Screening, get you the right posture in your shoulder blade. Movement mechanics is also important. You don't want to be that person that goes for a really strong, powerful overhead, hits the ball, and then all of a sudden you get this sharp pain and weakness afterwards. So proper warm up prior to playing, I would say, is important. I tell my patients to like throw a band or something in their bag and do some warm up muscles, just kind of pulling the band apart a couple different directions just to get the rotator cuff muscles warm and the blood to the area before you do that first powerful overhead.
And if you're going to play, how long should you warm up on the court for?
Yeah. I mean, it varies. I would say anywhere from like 10 to 15 minutes. What I recommend is just a dynamic warm up. So just taking a couple laps, running side to side, forward and back, a little bit more of the agility, calisthenics, more than just like standing, static, lunging in place or hamstring stretching. It's recommended just to kind of get the blood flow going, and anywhere from 10 to 15 minutes.
Gotcha. Cool. Cool. All right. So next injury is going to be an MCL strain. So MCL is a medial collateral ligament. And here specifically, we're talking about your knee. So of course, when you're playing pickleball, you're not just standing still. You're going to run. You're going to pivot. You're going to turn. You're going to twist. You're going to do all those things. So when we do that, you do have a risk of injury on that inside of your knee, and getting a sprain of this medial collateral ligament. So what you can do is, well, as Dr. Bennett already said, get there early, do some appropriate warm-ups, get the blood flowing, things of that. But maybe bigger picture is get your legs stronger. You need to, again, you can't just go from not playing this sport to all of a sudden going out there and playing for 2 hours. So make sure part of your program should be strengthening your legs, because as we've talked about in other podcasts, we lose 3 to 7% of our body's muscle mass every decade after age 30 if we don't do anything to help it. So we need strong legs.
All right. The last common injury for pickleball is the Achilles tendon. So you're doing a lot of standing at the kitchen line. Most people would say on their toes, ready to move. And in the back line, if after you hit that third shot drop or so, you're running up to the net. So the Achilles tendon is the tendon that actually attaches the calf muscle to the heel bone. And like I said, a lot of injuries happen as you push off or you land from a jump. So because when we start playing, we don't just play for like 1 hour. Of course, we play for like 3 or 4, and we play for like 5 days a week. Overuse injuries can be popular. So tendinitis can be a thing. And it's just so important that prior to playing, we talked about that warm up. So stretching the calf and then kind of starting with some light jogging, just kind of get that blood flow going to the muscles, doing a proper warm up. But as we just talked about too, proper footwear, a shoe that fits properly. Like I would just really recommend going to your local tennis store and have them. Ours is great here. Like try it on, make sure it fits. They'll help you. I do a little jogging in there. I had a patient actually that just started pickleball, and that was like I think he played for like a month. And the first thing he said to me was, I love it, but my right heel is killing me. So this kind of happened to him. And then we kind of looked into it more, and it was definitely lack of proper footwear. And then we started him on a little bit of a program just to get the muscles stronger. So that's where
Yeah,
he's
I've
at now.
got two comments. I have a comment
Yeah.
and a question. One, coming from a guy that had an Achilles tendon tear,
Ooh.
i.e., me. You don't want to have an Achilles tendon tear, so please warm up. Please do everything you have to avoid this.
Yeah.
But secondly, is that you talked about standing at the kitchen line. Now, I don't think when I think of I don't think my perception of standing at the kitchen line is the same as yours. What is the kitchen line? Because I'm thinking of food, but that's not obviously it.
So if you've seen pickleball played, there's a line. I should know this, but it's so many feet from the net, and you all like two players on both sides. All four players are usually, once you kind of serve, return, third shot drop, everybody races up to the kitchen line, and you do this thing called dinking back and forth until somebody kind of pops it up, and that's the fun part, putting it away or placing the ball, however you like to end it. But everybody's just kind of at this line. You cannot go inside of the kitchen. You
Hmm.
cannot hit the ball in the air inside of the kitchen. You have to stay behind that line unless the ball bounces, and then you're free to go in the kitchen and hit it. So let's just say the ready position is kind of like a nice squat on your toes, ready to move any direction.
Gotcha. Okay.
Mhm.
With you. I was somewhat confused about that. Anyway, go ahead.
I know this. I mean, pickleball in general, the name of the sport, they got this thing called the kitchen line. I mean, they're really not helping us out here. All right. So, warm up, warm up, warm up. We already talked about it. Recreational athlete that wants to start playing pickleball, I always tell them warm up is essential. Don't just go out there with your friends and think you're going to jump in. Maybe you're a sub or something for the week. It doesn't matter. Get your heart rate up, jog back and forth a couple times, dynamic stretching. So there's static stretching, dynamic stretching. You could go back to a future podcast, but static stretching would be just like standing and bending forward to stretch up my hamstrings, or pulling my knee back and stretching my quadricep. But dynamic stretching has movement combined into it. So it might be like static, like walking lunges at that point, or standing there and swinging my leg back and forth. So there's more of a benefit for that for prior to for warm up with pickleball. And then we talked about the agility aspect of pickleball. So changing directions, especially sudden changing in direction and squatting, happens pretty much every single point. So I tell my patients to kind of get down into a little bit more of a squat and do some side shuffles back and forth, maybe a little bit of grapevine or karaoke, whatever you call it, some lateral lunging. Those are always important. And then after you play, the cool down is just as important to avoid any soreness, trying to get that lactic acid out of our muscles. It's recommended about 5 to 10 minutes of walking, stretching your large muscle groups. But let's just say that if you're a person that is playing once a week or so, it's super recommended that you do something in between, the days in between, maybe every other day or every third day. At least go for a bicycle ride or a walk or a little strengthening workout program. One day a week of pickleball, you need to be conditioning in between then as well. I also want to say, we've talking in our job and stuff, we talk a lot about these orthopedic injuries, but if you're somebody that like doesn't really or hasn't, because of time or interest or whatever, work out, and then your friends want you to play pickleball, I have seen this and it's really sad, but like people get out there and they have like cardiovascular events or something, because it's
Mhm.
people think that pickleball is, like I said, like grandma ball or whatever. Like they don't think that it's that intense because the court is smaller, the net is a little bit lower, there's less movement, you're still playing doubles. But it's actually a lot of work running up and back from the line, and just please get screened if you're not a typical exerciser. It's just really important. I've seen this happen, and I don't want it to happen to you or a loved one.
Yeah, and I think when we talk about screening here, earlier we talked about getting a balanced screen, and that's done with a physical therapist. But the screening you're talking about is getting with your family physician and making sure that from a cardiology standpoint that you're okay to play. And I think you're exactly right. So many people think it's an easy sport and they go out there and bad things can happen. So
yes. Okay, so we've talked about it, but just a little recap. Must have a program leading up to participating in pickleball. If you're not active and you're coming out of retirement, can be prone to a hamstring or Achilles injury. Because it's an easy game to learn, a lot of people aren't as aware that they have to be in good physical condition or to keep up with it. So having strong core muscles, reasonably good balance, and some level of agility is 100% needed, and the emphasis on agility. So get with your family physician and your physical therapist, and you will become addicted just like the rest of us. Be just as annoying to all of your friends as I am.
Well, I want to thank our audience today for joining us to learn more about this craze that is called pickleball. It's absolutely amazing. I'm sure in every community out there, it's just being talked about everywhere. But again, thank you. Hopefully you learned a little bit more about common injuries and so importantly how to avoid them. We want to keep you on the pickleball court. You just gotta start it smartly. And also, we should probably talk about how. Because I had a couple of people last week that said, hey, where was your podcast on Wednesday? So our goal when we started the Healthy Habits for Active Aging podcast was to do a weekly podcast. But for any of those people out there that do podcasts, you know that doing something every week can be very challenging, especially because Lauren and I both are treating a lot of patients. People love the iMove PT model, which is where we do treat one-on-one and wherever a patient wants us to be. And so because that we've gotten so busy that it's been harder and harder. So we're sort of recommitting ourselves, and we're going to obviously keep our podcast going. We love it, but we're going to do every other week. So just look for our podcast, not every Wednesday, but every other Wednesday we'll drop a new episode. But as always, we want to thank our community for tuning in. Hopefully you enjoyed all this pickleball talk, especially from Lauren, who obviously you can just hear her passion and you should go to the iMove PT YouTube page so you can see that Lauren's been smiling throughout this whole episode. But anyway, thank you so much. And please come back in 2 weeks. And we're going to talk about tips on how to properly breathe. We don't think about that enough, but that's going to be a great podcast episode.
Yes.
So we hope everyone has a great 2 weeks. And for all the mothers out there, tomorrow is Sunday, and this happens to be Mother's Day. When you hear this podcast, it would have already happened. But we just want to wish everyone that is a mother happy Mother's Day.
All right. Thanks for joining. We'll see you in 2 weeks.
Bye-bye.
We hope you've enjoyed this episode of the Healthy Habits for Active Aging podcast. If you have any questions for Dr. Gorman or Dr. Bennett, please send an email to info@iMovePhysicalTherapy.com. To learn more about healthy aging, visit our website at iMovePhysicalTherapy.com. Like what you hear? Be sure to rate and subscribe. See you next week.